Great skin isn't about perfection. It's about keeping it simple and understanding your needs. Hi, Tira. Welcome back to Dear Dr. Jaishree, a series where I will tackle all your skincare questions and make it simple, practical, and perfect for you to follow. Dear Dr. Jaishree, my lips are always dry and flaky no matter what I do. Is there a secret to soft, smooth lips? Is there a secret? Well, why do you get chapped lips or dry lips? First of all, if you're dehydrated, so make sure you drink adequate amount of water. Secondly, if you're constantly licking your lips or smacking your lips, because they're dry, you do that, and then the saliva is going to make it drier. Remember, the saliva is your enemy when it comes to your lips. So avoid doing that. Then if you're allergic to lipsticks, lip glosses, especially the ones which have fragrance or mint in them, or sometimes it could be a toothpaste that you're allergic to. Sometimes it's even the after mint that you take or the mouth fresheners, which can cause dry lips and chapped lips. So you need to avoid them. If you're deficient in iron and vitamin B12, you can get dry lips or chapped lips. Certain medications, especially isotretinoin, which is given for acne, can cause a lot of dryness. If you're in a cold environment or in the AC all the time, again, your lips can get chapped. Finally, smoking. Smoking is a big no-no if you have dry, chapped lips because that leads to a vicious cycle. So eliminate the cause. Do not lick your lips. Always use petroleum jelly or any lip balm, and do not wear long-lasting lipsticks. Make sure you hydrate yourself well. Dear Dr. Jaishree, I've heard a lot about retinol, but it sounds scary. Should I try it? And how do I start? Retinol, first of all, is nothing but vitamin A. It's a derivative of vitamin A. It's extremely safe if you use it right. It's a versatile ingredient. It helps to reduce hyperpigmentation. It helps to reduce fine lines and dilated pores because it builds collagen. It also fights against acne. So it's something that a 16-year-old and a 60-year-old or a 70-year-old can use. So it's for all age groups, but you must use it right. Always start with the mildest form of retinoid, that is retinol or retinaldehyde. Start with once in a week application and never more than a pea size. So you dab it on the entire face. Remember not to apply it close to your under eyes, the corners of your nose and the corners of your mouth, because these are sensitive areas. You don't want the retinol to collect there and dry the skin further. Now, once you dot it on the entire face, gently rub it into your face. Do that once in a week. Don't forget to top it with a moisturizer. Now, if you have very dry skin, you can use the sandwich technique, which means first use a moisturizer or a hyaluronic acid based serum, then use the retinol, and then top it with another moisturizer. So that's the sandwich. Once your skin tolerates the milder form of retinol, after 2 to 3 months, you can switch to a heavier, more potent form of retinol. And a lot of times people think that retinol will thin your skin. On the contrary, it helps to boost your collagen and build new collagen. So it will never thin your skin. Sometimes there is flaking, there's redness, when you use retinol. Then you can also have purging, a lot of blackheads, whiteheads. Just hang in there. Your skin will need a couple of weeks to actually adapt to the retinol. So you can always moisturize a little more, use a thick layer of sunscreen, and you continue to use your retinol. Do not pair your retinol with a vitamin C or an AHA or a BHA at the same time. So you can't layer them at one go. You can use a vitamin C in the morning and a retinol at night, or you can alternate them. So a vitamin C one night, retinol the other night, AHA the third night. Finally, remember, if you're a female who's trying to conceive, retinol is not for you. You must stop topical retinol at least 1 month before you plan to conceive, and oral retinol, that's isotretinoin, at least 3 months before you plan to conceive. At what age should you start using retinol? As doctors, we prescribe retinol to even a 16-year-old who has acne. But if you want to incorporate it in your beauty, in your skincare routine, then you can start in your late 20s. And remember, this is for all genders. Even boys and men can use retinol. Dear Dr. Jaishree, Sunscreen always makes my face feel sticky and heavy. Is there a way to fix that? Well, probably you're not getting the right kind of sunscreen. Now, back in the day, I agree there were these thick, creamy sunscreens which would leave a white cast on your skin. But now, you have newer sunscreens which are water-based, gel-based, or even mattifying sunscreens, and they do not make you feel sticky. So opt for a lightweight, gel-based or water-based sunscreen. You can always apply a moisturizer first and then top it with a sunscreen so the sunscreen settles and doesn't feel sticky. And finally, you can also opt for mineral sunscreen. Zinc oxide and titanium dioxide will not make you feel sticky. When you apply the sunscreen, allow it to settle down a little bit. So wait for about 5 to 10 minutes and then top it with your makeup so that you don't feel heavy and greasy. When you top your sunscreen, you have sunscreen powders which can be used. So again, you do not feel heavy and sticky. Dear Dr. Jaishree, I'm seeing a lot of products with biotin. Does it actually help hair growth, or should I look for something else? Biotin or vitamin B7 is indeed required for hair. Well, biotin does help in hair regrowth, but you also need a whole lot of other vitamins, starting from vitamin A to B, C, D, also a lot of trace elements, selenium, magnesium, iron, calcium, and protein. Our hair is made of protein and amino acids. So you need to take all of these in order for your hair to grow well. I hope you enjoyed this video. Make sure to follow Tira's YouTube channel for a lot more on beauty.